Patrice, just keep it on the opening slide for now. Back. There you go.
So we'll get started.
Here we are.
All right, please go to the next slide. So welcome everyone. I'd like to especially welcome our board members, our founder, CEO, Dr. McCamey, our president as well. My name is Dwayne Aline, and I'm the board chair of DMPs of Color. So our mission is to build a community of nurses of color through networking, mentorship, and advocacy to increase diversity in doctoral nursing practice. I'm so excited to welcome you guys to our first event from DiMENsions in Nursing program. The DiMENsions in Nursing program came from my passion to advocate for men in nursing. With this program, we will bring a series of webinars, networking opportunities, mentorship, and advocacy events aimed at fostering professional growth and community among male nurses and our organization broadly. So I'm so excited to officially kick it off with the Fade to Wellness Symposium. So right now, I'll turn it over to Dr. Julius Johnson. Next slide.
Greetings, everybody, and welcome. It is so good to be here with you all for our event, discussing the importance of barbershops and healthcare. As many of you know, barbershops do not just serve only as a place where men or women go to get haircuts and to get fresh. It also serves as a place where we do a lot of things. We talk to each other, we hang out with each other, we communicate. But recently, what has been explored more and more and more is the fact that we also share a bunch of healthcare advice with each other. With that, we have several experts who all have significant history of utilizing the barbershop through channeling different avenues of healthcare and improving healthcare within the communities. We have wonderful panelists that I want to introduce to you all. I'm going to name them first, and then I'm going to read a very brief bio of everybody, because if I read everybody's real bio, we would be here till 12 o'clock tomorrow morning. All right. So we have Carter Tard joining us, Dr. Troy Williams, Aaron King. We have Josie Perpignan, Dr. Rashawn Ballard, and Dr. Reagan Johnson. So first, we have Carter Tard. Carter Tard is a nurse manager and the founder and immediate past president of the Capital City Black Nursing Association, the local chapter of the National Black Nursing Association. His route into nursing profession has taken him through all levels of the California education system. Carter is a graduate of Sacramento State University, obtained his BSN with SAMU Merritt University, pursued graduate studies at Betty Irene Moore School of Nursing at UC Davis, and recently received his MBA with Western Governors University. He enjoys community organizing, healthcare educational projects, and spreading all of the amazing benefits that nursing has to offer. He's a recent recipient of the Sacramento Business Journal's 40 Under 40 Award, Association of California Nurses Leaders Emerging Leaders Award, and the National Black Nursing Association 40 Under 40 Award. Engaging with community partners throughout California, Carter focuses on health education and nursing professional development as avenues of impact. Carter has also been a part of the inaugural class of the American Nurses Association California's Advocacy Fellowship in 2021. Another key thing about Carter that he did not mention here, but is a good thing to know, especially with the barbershop background, is that Carter played college football and played baseball as well. So welcome, Carter Tard.
Thank you, Dr. Johnson.
All right, next we have Dr. Troy Williams. Dr. Troy Williams is the Chief Impact Officer at the Greater Sacramento Urban League, where he provides strategic leadership, management, and guidance on initiatives and impact efforts throughout program evaluation, community engagement, and grant making. He's a community-based researcher and evaluator with over 10 years of experience in community engagement and public health. He has worked with multiple agencies across the United States interested in addressing systemic challenges, co-creating responses with community members, and conducting in-depth program evaluations. Everybody, please give a round of applause and welcome Dr. Troy Williams. I see the virtual claps. I appreciate it. I appreciate it. All right. Next, we have Aaron King. Aaron earned a MS from University of California, Davis, with a research emphasis in microaggressions and the impact on satisfaction and symptoms of depression in graduate nursing students of color. He is now a second-year PhD student, pray for him, everybody, at the University of California, Davis. His research centers on mental health interventions to reach Black men by way of the barbershop. He is currently the historian for the Capital City Black Nurses Association, but has served on the chapter's executive board in several roles since 2020. Aaron's goal is to increase diversity in the nursing workforce through outreach, particularly in communities of color. Aaron also serves as the co-chair of the Men's Committee for the National Black Nursing Association. Please, 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 everybody, welcome Aaron King. Next up, we have Dr. Reagan Johnson. Dr. Reagan Johnson is an associate clinical professor at Duke University School of Nursing. Dr. Johnson is a proud HBCU alum, receiving her BSN from Tennessee State University. Let me say that again, from the Tennessee State University in Nashville, Tennessee. She obtained her MSN as a family nurse practitioner and Doctor of Nursing Practice with public health specialty from the University of Tennessee Health Science Center in Memphis, Tennessee. She has had a significant impact in developing and collaborating in scholarship activities aimed at reducing health disparities. As a master clinician and educator with a public health focus, her scholarship addresses sexual health promotion and prevention of sexually transmitted infections, diseases, specifically HIV, in Black communities. She has served as the principal investigator of a community and internal university grant that addressed HIV prevention among Black male adolescents, using barbershops and barbers as venues of health information exchange in Memphis, Tennessee. Upon relocating to Durham, North Carolina, Dr. Johnson has continued this work with Dr. Shanita Randolph, expanding to Black women and biomedical prevention of HIV with PrEP. Dr. Johnson has a strong passion for bias and racist-free nursing education as well. As an FNP educator, she has provided training on developing anti-racist curricula for NP students, preceptors, and educators. She is committed to marginalized communities and eliminating health inequity and racism in healthcare and healthcare education. Please, please, please welcome Dr. Reagan Johnson. And last but certainly not least, we have Dr. Rayshawn Ballard. Born and raised in the city of Baltimore, Maryland, Rayshawn is a dynamic professional with a unique blend of expertise in the art and science of nursing. Rayshawn is a graduate of the inaugural BSN to DNP cohort at Coppin State University, with training as a doctorally prepared family nurse practitioner, holding a Bachelor's of Science in Physics from Morgan State University and a Bachelor of Science in Nursing from Coppin State University. Rayshawn has bridged the realms of science and healthcare. His background encompasses roles in oncology, urgent care, emergency medicine, and intensive care. In his current role, he oversees the training department for the Southern Maryland region of Patient First, where he plays a pivotal role in ensuring the highest standards of training and development of nurses, medical assistants, X-ray and laboratory technologists across 12 urgent care centers. Beyond the clinical realm, Rayshawn serves on the Health Empowerment Ministry at New Psalmist Baptist Church. He is a dedicated member of esteemed professional organizations such as DNPs of Color. Say that again, such as the DNPs of Color, the American Association of Nurse Practitioners, American Nurses Association, and Maryland Nurses Association. In his research endeavors, Rayshawn focuses on understanding African-American male primary care seeking behaviors aiming to address disparities and improve healthcare outcomes within this demographic. He brings a multifaceted perspective to the table, equipped with a wealth of clinical and leadership experience. With his unwavering dedication and diverse skill set, Rashawn aspires to make a profound impact, both within the healthcare community and beyond. Please, please, please welcome Dr. Rashawn Ballard, and we are all going to hold him to teaching us the Baltimore shuffle that we've been seeing going around in the community.
Thank you. I'll do my best.
All right. So next, we'll have panelist presentation. So I will welcome back Carter Todd and Dr. Troy Williams to take over and give a presentation on their works with barbershops.
All right, how y'all doing? Such a pleasure to be on this esteemed panel and be able to talk to y'all briefly about this amazing initiative we've created together called Cut to the Chase and Cut to the Chase, the Crown Edition. Next slide, please. So Cut to the Chase came out of my doctoral research. I conducted research on Black third spaces. So your first space is your home, your second space is work, and the third space is somewhere where you can come and kind of show up and just be yourself. My research found that the more access to these types of Black spaces that folks have, the less likely they are to use opioids to deal with the stress and life that they were kind of navigating in their daily life. So in 2022, there was a grant that was announced that wanted to deal with the social determinants of health. I was very familiar with the impact that barbershops can be utilized as a site for spaces. So we wanted to put together a group therapy session for Black men specifically initially when we launched in 2023. When we finally launched, we applied for it with Capital City Black Nurses Association, and it started to, and it took off. Next slide, please.
And Dr. Williams might be humble here, but he is an inaugural nurse by affiliation, as being the only non-nurse on this panel. But the relationship that Dr. Troy has with us and Capital City Black Nurses was a very organic and serendipitous connection that we had. Capital City Black Nurses had already done several different outreach programs before COVID, during the pandemic as well, and even after, via the barbershop here in Sacramento, with the nursing lens, nursing focus, bringing our expertise and bringing our trusted profession into the community to try to impact the health disparities that we've seen. So when Dr. Williams reached out to us and wanted to collaborate, we knew it was the perfect mix.
Yeah. So thank you so much for that, Carter. So we now do barbershops and beauty salons, and this is Cut to the Chase. It is a trademarked idea and patented program that we put together, and it has these four brilliant components. We have group therapy sessions. Now, quite often, folks have like sessions for men in barbershops and in beauty salons, but very rarely is it actually facilitated by a trained and licensed clinical therapist, and that's one component that we have. Also, after the therapy sessions, we offer one-on-one sessions for clients who may be interested in it. So if a person may be talking too much or saying some things that we realize that, hey, you may need to go see a therapist on a one-on-one sessions, our initiative pays for up to 4 sessions per month for clients. So that would be 4 different individuals. Next, we produce stigma reduction materials for folks to be able to read and understand about therapy to try to reduce the stigma surrounding therapy. And last but not least, we have medical moments. This is when our nurses open up our session and kind of talk about something that may be beneficial. And I'll let Carter jump in and talk about how we've tied this both in.
Yeah. So the medical moments have been a really rich dialogue and opportunity for us to focus on different health topics that are specific to the times, specific to the area. And we have kind of, a relaxed, regular conversation like you would in a barbershop, but facilitated by us nurses. We have nurse practitioners, nurse professionals who kind of lead different discussions. And it's really nice because we just start with a very specific question, specific disease process. And it can go anywhere, right? So we have 2 sessions a month for the men, one in Oak Park, which is a predominantly Black neighborhood in one part of Sacramento, and on the north side of Sacramento in De Paso Heights. And even those 2 dialogues will be the same topic, but could have a different trajectory and outcome for some of the men there.
Next slide, please. So these are the components that we have found to be very successful for our program. Us as GSUL, which is the community-based organization. Second is the Barbershop and Beauty Salon. And I also want to state this. I actually just presented this at the National Urban League, to the National Urban League yesterday. So the Urban League, for folks who don't know, we're the second oldest civil rights organization in the country. We're a year younger than the NAACP. We serve over 300 communities. We have over 90 affiliates. So we have a very big stronghold on the country when it comes to advocating for African Americans throughout the country. So we, being the community-based organization, which is at the top of this circle. Next is the Barbershop and Beauty Salon. And what I was speaking to a lot of my other affiliates about is that you do not want to walk in and select just any barbershop or beauty salon that is available, right? You want to have a barbershop that is more professional. They have a good rapport with their clients. They may be more active on social media. This actually contributes to the attendance in these group therapy sessions. Next, we have a Black-owned therapy practice that's been extremely helpful. We pay them per month to provide the therapy sessions. Next, Capital City Black Nurses Association. And last but not least, we have a very charismatic facilitator who helps facilitate the sessions. Anything you want to add to this at all, Carter?
To your point about the barber specifically, yes, the business itself is very imperative to the success, but the charisma of the barber, right? We can't underestimate the value that brings for us as men in the barbershop, right? We can get our hair cut anywhere, but picking and having barbers who are very in belief of what we're trying to do, to understand the importance of health and mental health for the Black male community has been really nice to see. I know at both of our sites, both barbers are very engaged with the conversation, sometimes overtaking the conversation. But that's a really good thing because naturally they are the storytellers and story keepers of our communities.
Yeah, absolutely. Next slide, please. And last but not least, this is something that came out of my research. Quite often, we would find that individuals would try to, let's say if they came upon $1 million grant, they would just try to create a Black third space for Black folks. And what we found is that just because you create a space for Black folks, put it in a Black community, that does not guarantee the attendance of Black participants, right? They need someone who is going to be present and ensure that they feel safe. So what I identified in my original research was that the presence of these intermediaries, these are individuals who can kind of navigate in between the spaces and advocate for folks. So this could be your nurses, this could be your barbers, but these are people who are advocating for the folks in the community and let them know, hey, y'all, this resource is available and this is a safe space for you to be able to come to.
Very well said, Dr. Williams. And as we've seen, that snowball continues to roll, right? You get your first couple of barbershops going, attendance is at a core people, but as that stigma gets kind of brought down about what we're doing, where we're at, that space becomes more and more valuable. And then you get these big groups of folks right here who are ready to come back every single month. And Dr. Johnson, we will give it back to y'all.
Mm-hmm. Oh, okay, wait, there was one more slide. I thought that was the end. All right, so just go to the next slide, please. I'm sorry. Just some of the high points of our success metrics. We've served over 1,000 people in our 1 year since launching. Since that, also 52 of the clients have signed up for long-term care through our therapists. And next slide. Yep, that's it. Okay, thank y'all.
All right, fellas, thank y'all for that very inspirational slideshow, and more importantly, for the work that y'all are doing in barbershops. Can't thank you enough. I know therapy always takes place with your barber, but sometimes your barber get tired, right? He can't cut your hair and be the therapist for 25 people he see on Saturday. So thank y'all for the incredible work that y'all are doing. Before I get to the next presentation, I want to introduce our final panelist, who's also presenting on this next presentation. Josie Perpignan Jr. I've had the distinct honor and pleasure of knowing Josie since he was a freshman in college. I don't know why, but somebody thought it would be a good idea for me to mentor him. So if there's anything wrong with him, please blame me. If there's anything great with him, please give him all the credit, right? So Josie Perpignan Jr. Is an award-winning community healthcare champion. He's has more than 13 years of healthcare experience as a patient and as a healthcare and patient advocate. He currently holds a Bachelor of Science in Nursing from the University of Rochester. He also, as of last month, also holds his family nurse practitioner degree as well from the University of Rochester, and he is currently in its Doctor of Nursing Practice program there. He's a native of Crown Heights, Brooklyn, and has a mission of community caring. And he's a father. He's a father, and his dad was an emergency medical technician, and brought an ambulance to his school on career day, and really inspired him to become a nurse and get into the healthcare profession. Josie is a co-founder of the Greater New York City Black Nursing Association. And honors his commitment to providing needed resources to underserved communities that lack access to adequate medical services or are unfamiliar or distrustful of the healthcare environment. He has delivered impact by helping to build trust with local hospitals and within the healthcare system. Mr. Perpignan Jr. also gives back as a mentor to children, going into communities to uplift those who do not have role models to emulate. Mr. Perpignan Jr. has received numerous awards and accolades for his dedication to the profession, including, but not limited to, winning the Lives Healthcare Hero $100,000 giveaway sponsored by Live with Kelly and Ryan. I'm still waiting for my piece of that check. And in recognition of his work on the front lines and his commitment to the community during the COVID-19 pandemic, he was pleasantly surprised to discover that he won the award while live on air with Kelly, Reaper, and Ryan Seacrest, learning he won the award out of thousands of nominations. He's also a 40 Under 40 award winner for the National Black Nursing Association. He's also a Rising Star by the Greater New York City Black Nursing Association. He's also won Daisy Health Equity Award for Frontline Registered Nurse. He's won a Humanitarian Award from the University of Rochester. He's won the Graduate Nursing Student Association Advocacy Leader from the University of Rochester. He's also an Unsung Hero of the Year nomination from the Rochester Black Nursing Association. I can go on and on and on about Mr. Josie Perpignan, but I want to bring him to the stage and welcome him. Welcome, Josie Perpignan Jr.
Thank you, brother.
All right. So next, we're going to jump right in and keep the presentations going. We have Aaron King and Josie Perpignan presenting MBNA Barbershop program, promoting health in Black communities. Fellas, take it away.
All right, thank you so much. That was quite the bio. I think, and I'm glad to go, I'm able to go second, but before really discussing the work that we're doing, Josie and I are doing with MBNA, I really want to take a time to look at some innovation that's happened in some barbershop programs. As we know, most barbershop interventions started as early as the 1970s. But Dr. Relaford, a podiatrist by trade, is the one who actually really added some innovation, launching the Black Barbershop Health Talks, or excuse me, Black Barbershop Health Outreach Program in 2006. So this was actually a national program. So many of the barbershop interventions that we see are really local, community-based. But this program really leveraged the resources that they had to really supply barbershops across the nation with supplies to be able to host their own programs. So they actually shipped toolkits nationwide, screening 30,000 men for hypertension and diabetes. They've organized over 5,000 volunteers and over 1,100 barbershops nationwide. And I mentioned this program specifically, and I always come back to it because this was actually my first interaction in introduction to barbershop-based interventions. And so the picture here that I have was actually as an undergraduate. And so I just wanted to start with that, really looking to highlight the innovation. Next slide. I also wanted to introduce the collective impact approach. So the collective impact approach really looks at how community members, organizations, and institutions who advocate for equity can learn together, align, and really combine their forces to achieve population and system level change. So it's about really looking at how can we as nonprofits, or how can we have organizations or community members really leverage the power that we have and combine our forces to really solve the same issue. And so I've been looking at this, and I've been really leaning on this as I work through with different programs of how can I best, instead of stamping my name on everything, how can I combine our forces, right? And I think an example was how Dr. Troy Williams and Carter Todd mentioned what we're doing locally with two nonprofits, Black-led nonprofits coming together and really leveraging our strengths in different ways to improve outcomes for our community. Next slide.
All right, thank you, Aaron. So as Aaron was saying, the importance of being innovators and being able to utilize these spaces and being on a platform and having a platform such as being a part of National Black Nurses Association. Although we have our chapters in different cities, they're in Sacramento, we're in New York City, obviously. We've worked very closely, and we ended up really building bonds and a connection. And as Aaron said, having like-minded individuals together working to the same issues and bringing light and shedding information and resources and doing these things in a community that we know that are needed. So we were able to come together and stream our live, our first live barbershop event, which was live streamed. So we were in New York City at CCBNA, they were in Sacramento, and we were able to have access to a live stream where all of the nation could watch the barbershop event. This event was like the initiation to what it was that we knew we'd do in the long term. So it basically started off with just having conversations with our community members within the community, specifically for Black men and their healthcare. But as conversations, we spoke about anything dealing with mental health, whether it's different types of comorbidities, diabetes, hypertension, mental illness, and how those issues and illnesses really affect the Black man in the community. And why it's so special is because we were able to utilize and show that, we're in an environment that, individuals, like for myself, I go to the barbershop, I have a really good relationship with my barber. This is someone that I entrust. This is someone that I talk to. This is someone, it's sort of like a form of therapy to a sense. And a lot of Black men utilize their barbers for such. So we figured this would be a perfect platform. We're not in a hospital setting. We're in a setting that's familiar and comfortable to the community. And most of us are from those communities, so we know what it's like. And it was an amazing event. We had a great turnout. We had moderators, and we had great topic discussions. And go on to the next slide. I'll talk more about a lot of the different programs that we've done. So other events that were done, also like CCBNA and being sponsored with UC Davis. Another very informative event that was done was Sacramento's Men Discuss Gun Violence and the Impact in the Black Community. So this was pre-recorded. So as we may know, since the pandemic, it was hard for us to, be in the same setting or to be live in person, to have these sorts of events. So as the innovators that we are, we decided, how could we get this information to our community? How could we have these important conversations, and how could we get these resources and this to the community members that need it most? So we were able to start live streaming, pre-recording episodes and allowing access so that individuals can go back and look at the topics and the different episodes that we have. So this one specifically, so we want to basically talk to gun violence. Why this was special was because not only did we have a conversation about gun violence, which is an easy thing to do, not to do, but it can happen. It's what part did you have involved? So when you think of a community member having someone that may have been shot, right? So we have a victim. Now we have someone who's providing surgery to keep this individual alive. That is a trauma surgeon. And now what happens to this family? What happens to this individual? What happens once they transition out of getting care within a hospital setting, now having to go back to their normal lives, back into the community? So now you have mental health, so we had mental health specialists, we had a we had a surgeon, a trauma surgeon, and the actual victim able to speak to this topic specifically. So it brought a different raw and realness to it, because not only are we just talking about, we have the individuals involved with the entire process from beginning to end, really share their experiences and be transparent and open with their vulnerabilities. And this was really good because it shed light on the importance of mental illness and what aspects and resources we have to be able to support our community members that are in need. All right, next slide. So at our 51st annual MBNA conference, we were able to have an amazing event. This was the first barbershop event on a national level that we've done. And we basically focused this one on disparities in organ and tissue donation. I once was a transplant coordinator. So we in New York City had a great relationship with Live On New York, which is an organ procurement organization, and so is the Sierra Donor Services in Sacramento that CCBNA has also built a relationship with. And we started off on a smaller scale, addressing these disparities, and just knowing that in the Black community, we're more than likely across the board, depending on which organ it is that is needed, #1 on the list in all aspects. And to talk about what is preventing our people from being able to get transplants and having these conversations. So we were able to have Dr. MJ Collier moderate our Cuts for a Cause, the life saving power of organ donation at our conference. And not only that, the importance of just putting ourselves out there. So with Sierra Donor, with Live On New York, those are 2 OPOs. We were able to get sponsorship from over 15 OPOs. So what that does is allowing us to space into smaller communities, smaller cities that have these issues going on, and we're becoming the voices and advocates for these cities, and allowing our network and really leaning on our network, our local chapters, to really build those connections and relationships. So this was live streamed as well, and we were able to have it pre-recorded so that people always have access to these events. So I'm gonna pass it on to Aaron. Just want to add in that these events are some of what we've done. We have much more to come, and it's just growing more and more the more we invest in and really put ourselves out there.
Thank you, Josie. We'll go ahead and hit the next slide. So our first event, so that first national event that we did was successful. We got a lot of great feedback. It was able to be in front of a live audience. It was streamed virtual. But looking at, did we really reach all the people that we could? Did we reach the right people? Looking at the foundation of Barbershop Interventions, this really brings in community. And so Josie and I had a lot of conversations around that, and how could we best reach community? How could we best use our national program platform to really bring these resources into community? And so we kind of created this model, and it looks about how could we really uplift and utilize the collective impact approach to uplift existing programs local to our conference. So every year, this was our 51st. We'll be celebrating our 52nd this year in San Francisco. But entering in these different cities to host our conference, how can we get into the community? So as I mentioned earlier, it's not about us wanting to brand our events and going out. Why not uplift the people that are already doing the work? So with the use of our platform and really leveraging the connections that we have at a national level through sponsorship, we decided that this would be our new approach to how we at the national level for the Men's Health Committee connected and did barbershop work. Next slide. So, so this year we actually had the opportunity to work with Campaign for Smoke-Free Kids. This was a relationship that we formed very organically at our last conference in Atlanta. We've had some meetings about how we can collaborate and really work. And so the first event that we hosted with them was really focused on the Black family and the impact tobacco has. This was a virtual event that was well attended, and they were very excited about a possibility of collaborating for future events. And one of the events, one of the things they mentioned was getting together to possibly do an event at conference. And so they had already kind of heard about the work that we did with barbershops the previous years with the organ procurement organizations. And so this was our opportunity to really work out how we can do an event using this model that we created. So this year we actually I did the search of like barbershop initiatives in Oakland, which is like there's so many. But I do have some connections and some relatives there. And one of my cousins connected me with his clinic that he works with in Oakland. So next slide. So this clinic is called Roots Community Health. It is a FQHC that was founded in 2008, and their program is called hypertension. And so it lent very well to tobacco, right? I don't have to tell anyone on this call the relationship that tobacco has on hypertension, on blood pressure. And so we thought this would be a great pairing. So we reached out to the program. We connected the campaign for smoke-free kids, met for a couple calls, and what we've decided to do is not necessarily have a program inside of a barbershop or have an event inside of a barbershop, because unfortunately, if you've ever been to the Bay Area, they don't necessarily have the real estate for all of that. So we did utilize some spaces that Roots Community Health has. So their hypertension program, just to do a little bit of a plug about that, it really looks at they connect with 11 different barbershops across the Bay Area, Oakland and San Francisco, and they give a stipend to barbershops. And the barbershops are responsible for collecting a certain amount of blood pressures monthly. Those are entered into the clinic or submitted to the clinic in the form of referrals. And the barbershop, the physician from the primary clinic comes along with a pharmacist and sets up appointments with men inside the barbershop, and they have the ability to prescribe there at the business. And so for every follow-up appointment, for the initial and every follow-up, the men in the community that attend, they get a free haircut. And so it's been very successful. This program is led by Dr. Tim. He is a primary care physician over at Stanford Health. And so what we have planned for this year for our partnership is that we are going to be hosting a live event, really looking at how not only the education around tobacco, but we're also going to be providing more wraparound services in the form of tobacco replacement therapy. And so right now we're in the process of getting the medication donated to us, the products donated to us, so that we could give out to community. We are going to have primary care providers and pharmacists to talk to community, to educate about different treatments for tobacco in addition to hypertension. We're going to be having music, we're going to have food, and we are not only going to take it to what can you do for yourself, but what can you do for your community. So there's going to be a real large component of education around policy and how you can advocate for your community to keep not only yourself safe and healthy, but also your children. So this event will be coming up in the national conference next month. Next slide. So these are just some of the references that we have. Again, this event that we're hosting will be recorded and be edited and be available online. So look out for that to be shared nationwide. Thank you so much.
All right. Thank you, gentlemen, for that great presentation and all the work that you are doing. We have one more presentation before we get to our questions and answers period. All right. So coming to the stage now, we have Dr. Reagan Johnson, and she's going to be doing a presentations on barbers and the talk.
I'm happy to go next, but I think Dr. Ballard is next.
Oh, I'm sorry about that. Yes, my apologies. Skipped right over you, Dr. Ballard. So we have Dr. Rashard Ballard going with an exploration of motivations for primary care seeking behaviors in urban dwelling adult African-American males, 18 years of age and older, a grounded theory study. Dr. Ballard, please
All
forgive.
right.
Welcome to the stage.
No worries at all. Thank you, Dr. Johnson. I appreciate your moderation today. This work was near and dear to my heart because being an African-American male myself and just talking to so many men throughout my life and I mean in the community, African-American men are at a dire state, and during this research, I found how dire it was. And I'm going to talk about that in a second, but this is work that I did for my doctoral program, for my DNP program. And with this work, it was really important for me to understand what was it or what is it that motivates African-American men to want to go and seek primary care? Because this is going to be a part of the presentation, but that's where it all starts with preventing a lot of these chronic diseases and also helping to manage these diseases. So we're going to get into the research study that I did to discuss and come about these motivators. Next slide, please. All right, so as far as identifying the problems, so of the top 10 causes of death for African-American men, 8 of those are due to non-communicable diseases. So you're talking about high cholesterol, high blood pressure, diabetes, and in that you're also looking at heart disease, cancer, Alzheimer's disease, and also stroke. Those are the top 4 leading causes of death for African-American men. And these diseases are completely preventable in most cases when you're looking at modifiable risk factors. And so even though the primary care environment exists, there is a shown underutilization of primary care services that is happening with African-American men. And it's a vital source of care in order to, again, prevent these types of diseases from happening. Next slide, please. So why this was significant is because when you jump into the literature and look at what's out there, so African-American males have the lowest lifespan of any group in the United States. This is due largely to non-communicable diseases. And so these diseases such as diabetes, cancer, and hypertension, this is super important because these things are killing African-American males daily. If you look at any age group, African-American men are the youngest, in any age group because African-American men tend to die off earlier than anyone else. And in the last 3 years, the lifespan has actually decreased, and it's a higher decrease than in any other demographic. Also, African-American men are more likely to die earlier from non-communicable diseases as well, compared to their counterparts in other races. Next slide, please. So, of course, in order to really understand things, you have to talk about money. And so money is where we really get to see what the impact is. And so when you're looking at non-communicable diseases at a global level or at a higher level nationally, $3.8 trillion is spent every year on non-communicable diseases and managing those diseases. So that's a lot of money that's spent on everyone. And when you're looking at that, even with African-American men being 13% of the African-Americans being 13% of the population and African-American men being half of that, that's still a significant impact to the economy in order, which shows the importance of managing this, even from an economic perspective. And when you look at the differences between races, African-American men have a $586,000 expense versus $204,000 spent by non-Blacks over the lifetime. We're looking at healthcare spending. Also, you're looking at when it comes to on insurance, African-American men are disproportionately uninsured, with 9.7% of African-American men not insured, whereas 5.54% of whites are not insured. And again, you have the primary care environment. The primary care provider is really there, in order to manage these diseases and be able to also give the information to African-American men in order to become healthier and to avoid these diseases, and also manage them so that they can also overcome these diseases and live longer lives. However, what we're tending to see is that African-American men are used in emergency departments instead of their primary care providers in order to get health care. And that's really a problem, because when you're looking at emergency department versus primary care, what you're missing is that continuity of care, which is really important. And you don't have that with the emergency department. So we're really putting a Band-Aid on a much bigger problem. And also, African-American men are also 50% less likely to have had contact with a healthcare provider within the last year, regardless of their insurance status and income status. So for me, the question then became, okay, well, why is this that African-American men are choosing not to go? So what is motivating African-American men to go to their primary care providers? Next slide, please. So there was an extensive review of the literature that was done as a part of this DMP scholarly project. However, I just want to highlight two studies that were most significant here. And so with the first study that we're looking at, the first finding that was really important was that a lack of health insurance was a significant barrier to establishing the usual source of care. And as we stated in the other slide, so there are more African-American men that are not insured than there are people of other demographics. So that's going to be a barrier that's going to present itself to going to primary care. Also, family plays an essential role in promoting healthcare use among these men. So that's important to also know, because when you are looking at marketing strategies and things of that nature, you don't want to just go out and talk to the African-American men. You also want to look at families as well. Also, the quality of relationship was really important, and we'll see that theme come up again later on in this presentation. And also, with age and maturity, there is also an increased interest in seeking primary care as well. And finally, positive messaging is important. And that has been shown as well when it comes to healthcare utilization. The second study here also showed that medical mistrust, and we are all aware of different stories such as the Tuskegee experiment, and also Henrietta Lacks, where African-Americans have been put in a place to feel uncomfortable. And so that also lowers the number of healthcare visits that African-American men engage in as well. And also the perceptions of racism are a huge impact as well, because if people feel that they are not getting care that is directed at them, they're going to avoid the primary care provider. Next slide. So when looking at an approach to conducting this research, I looked at many different ways of going out and doing it. And I landed on grounded theory because with grounded theory, it's a type of research method where you are going into and you're looking at the actual experiences of the people who are out there. And so coming from an African-American I'm an African-American male myself, and also just being around African-American men, I know how important trust is. And so grounded theory really allows for you to immerse yourself in the culture and to get real world experiences from your actual participants. And again, that comes with trust. And this is where, for me, the barbershop came in to play, because as discussed by the previous presenters, the barbershop is a great place in order to engage with African-American men. And even just being there and just listening to the different discussions and things of that nature, so many African-American men depend on that barbershop culture in order to just discuss health topics, and not just physiologic health, but also mental health as well is heavily discussed. And so I thought this would be a great ground in order to talk to African-American men and understand what it is that they were looking, how they were feeling. So another thing about grounded theory is that you don't walk in with a theory. You actually walk in just listening to your participants. And with that, when you are finished, you're going to come out with an actual theory, and it's grounded in the actual observations and experiences captured from the data that you gather from the participants. Next slide, please. So as a part of my methods for this project, I used a semi-structured interview guide that was review by a qualitative nurse researcher in order to ensure that it was the questions were correct for what it is that I was trying to ascertain from these men. And so there was a part of the survey that included demographic information, so things such as race, age, where they resided, also primary care provider status, and also the last time they saw a primary care provider. The participants were offered the option to either do a paper survey, or they were offered the option to access the survey via a QR code, and I'll show you that in just a moment. But really, when you get to the basis of it, the questions were designed to explore what were the experiences of these African-American men and what were their interactions like between their primary care providers in order to understand how they shaped the thoughts in order to go into primary care. Next slide, please. So this is my my setup right here in the barbershop. So again, the barbershop was a setting that I chose, and again, I learned so much here in this environment, just listening and talking to the gentlemen. And my participants were, I chose adults that were over the age of 18 years of age. And the reason why I chose, that age group is because that's where the USPSTF and they do all the guidelines as far as screenings. That's where hypertension screening begins, and then it goes beyond there. The ages go up, but 18 was a good starting place. Also, of course, African-American males were the participants, and this was in an urban environment because that's where my population of focus was in. And when it came to recruitment, I used what's called propulsive sampling, which basically means that I go to the area where these my participants are. And so this is a predominantly African-American male servicing barbershop here. And this is my setup right here. So if you look at the picture here, what I have is as an incentive, the gentlemen were offered some snacks, also some water, and then there were some T-shirts that they were also offered. And if you look at the little flyer right there, it has a QR code, and so the participants were able to access the survey via the QR code and then fill out and answer the questions. Next slide, please. So in order to analyze the data that was captured, I used what's called thematic analysis. And with thematic analysis, it is looking at the participants' responses and then coding the data on different levels and finally coming out with a theme based off of how they answered the question and what is emerging as the overarching theme for each question. And so this was a lot of work. It took actually months to actually go through and do this from the participants that were in the study. And basically, in order to ensure that rigor was achieved, we looked at the themes and made sure that going through all the levels, there was a constant going back and forward to make sure that the themes really represented what the participants were saying. Next slide, please. So what I derived ultimately from the results of the study was what's now titled the ballot theory of primary care seeking motivators in adult African-American men. And so with this theory, what I was able to develop was that African-American men do value health and engaging with healthcare. We see healthcare as an essential for our well-being. And so if you hear that African-American men don't care about their healthcare, well, I found out the exact opposite from the data that is shown here. African-American men absolutely, were shown to care about their well-being and engaging with the healthcare environment. Also, it was shown that care does go beyond transactions. And so the relationship with the healthcare environment is built on trust and aims to provide a holistic experience, patient care experience. And so African-American men don't want a transactional experience where I come and see you, I get something and I leave. It has to be a holistic experience where I really feel that you care about what it is that I want. Also, engagement for prevention and management. So African-American men do seek engagement with healthcare providers for prevention and management existing conditions. And so when I'm talking to these gentlemen, it was found that African-American men go to their primary care providers, not just for acute concerns such as injuries, but also to manage their health. And so it is important to African-American men to prevent these non-communicable diseases. And finally, a supportive network is important. So the supportive network includes the healthcare team, the African-American males community, their personal motivations such as spirituality and self-concept. And these are, really key into encouraging African-American men to seek care. Next slide. So to sum all of that up, there was a model that I developed, which is the increased primary care engagement model. So if you look at the left side of the model, you first start with the intent. And so the African-American male's intent. And so when you go forward with that intent, so quality encounters, authentic relationships, and also the care environment, these are things that will cause an increased primary care engagement. And with this model, these things all work together. And so if you are missing those three things, it's going to impact the intent to go to the primary care environment, and in which we see a decreased primary care engagement. And so really from this model, the goal is to take this to the next level and look at some other types of future research, such as comparing urban versus rural environments. And also maybe even looking at just African Americans, from a general standpoint as well. Next slide. All right, so these are some of the references that were used here in the study. Next slide. All right, thank you for listening to this presentation today.
Dr. Ballard, thank you for that well-formed and deep, in-depth, and in-depth presentation. We really, really, really appreciate it. On to our last presentation, but definitely not the least, before we get into our panel discussions. I'm going to bring back up properly this time, Dr. Reagan Johnson, to talk about barbers and the talk. So, Miss Tennessee State, please come to the stage and let us know.
Thank you so much. And thank you, Dr. Johnson, for moderating this excellent panel. To all the panelists that came before me, I really enjoyed hearing about your work. So I want to talk about everybody's favorite topic, sex. Next slide. And so this work is done with Dr. Shanita Randolph as the PI at Duke University and was funded by Betty Irene Moore Fellowship. Next slide. I just wanted to acknowledge our heat lab, which is the lab that we work out of for our research, but then also giving special attention to our barbers that participated in this project and have really participated in all our projects for the last about 7 years. So Jean Blackman and Keely Hester, and then the rest of our heat lab team. Next slide. So a little background about kind of how I got into this. I'm going to date myself, but I worked at a beeper shop. So anybody who's 40 plus had a beeper back in the days. I worked at a beeper shop. And next to this beeper shop was a barbershop, beauty salon, a lot of chairs, a lot of people in there all the time. And this was back in the day where, it was popping on a Saturday. And the conversations were always sex, right? And it wasn't always a great understanding of communicable disease, susceptibility to STIs and whatnot. And as I went off to college, to TSU, I was in nursing school and needed to get practice on doing blood pressures, and they came back and the barber and I was like, no, come on, Reagan, you can do all your blood pressures. And he's like, one Saturday I did everybody's blood pressure. And as I was doing that, it just came to me like this is an excellent exchange of information between a willing audience, right? And a ripe place to shift language of how people give information. So if the conversations are already happening in the barbershop, this is a great way to make sure that the conversations that are happening are evidence-based and beneficial to the community as a whole. So why Black male adolescents? They're more likely to contract HIV. As you can see, for Black males or males in general between the ages of 13 and 24 living with HIV, over 50% are Black. On the flip side of that, with our girls, 63% are Black living with HIV, and over 80% of girls and women that contract HIV do so through heterosexual contact. So in addition to, we do have a salon project educating girls and women. We also focus on our males too. If girls and women are getting it through heterosexual contact, then we need to involve the men. Almost half of youth and young adults, and that goes for Black adults as well, are unaware of their HIV status. There are a lot of people who lean heavy into behavioral factors and individual level factors first as to causes and intervention starting there. We include behavioral factors, of course, but we also lean heavily on our social, political, structural drivers of health that lead to increased HIV. Racism, of course, and that includes both racism that leads to the school to prison pipeline, but also medical racism that results in substandard care when you do access care. Socio-political drivers such as not expanded Medicaid, especially across the South, prevents folks from having access to care, treatment, and also prevention. And we have seen behavioral factors such as condom use decrease over the past decade. So according to the Youth and Behavioral Health Study, surveillance study that's done yearly amongst teenagers, we saw a sharp increase in condom use about 10 years ago, and that's slowly been declining over the last 10 years. Part of that, I think, too, we think about the last 4 to 5 years of COVID made people not in close contact. I think somebody had already said that. And so we saw a decrease in HIV numbers during the time and STI numbers during COVID. Now they're starting to spike again. And we assume that those were always false numbers, right? And that people were indeed having sex if they were doing nothing else, but they weren't going to testing. So we weren't getting the numbers. And then substance use amongst this category is and population has increased significantly, which also leads to condomless sex and multiple sex partners. So one method we really value is communication. And that communication really needs to be culturally relevant so that our youth will engage with it, and it must include their network. So similar to, I forgot who went first, but his slide on the third spaces and how your first space is home. So that's one of your networks. Your second space is work, and in this case, school, that's their second space. And then there are other third spaces. And the barbershop is one. If you think about, a lot of these folks have been going to the same barber since they got their first haircut at 1 year old, right? So they've been with these folks 12, 13 years. They know them and they trust them. Next slide. So our intervention really partners with our barbers and barbershops to really think about how we can influence the culture and then influence social norms. And so what people talk about is what you do, right? What the community says is good is what's good. What our influencers say is good. So, and barbers are one of those people. So the first thing we did was wanting to make sure that our barbers were properly educated. A lot of the prior research showed that barbers and clients would be willing to accept information from sexual health information from barbers, and barbers would be willing to give it if they were properly educated on how to do it. And so not just what the evidence-based information is, but also we talk to them about how to initiate conversations outside of what may normally come up in the barbershop, right? Somebody just talking about a date that they had, or a new girlfriend, or a new boyfriend, new interest. And so we wanted to think about including the parents as well as their formative and like home space of how you increase your conversations about them, because that's the person that had to take you to see about getting care, see about access, if you have insurance, if you don't have insurance, showing you where you can go to facilitate care and prevention. Next slide. Oh, before you go into it, so that was a 3-part prong of how we approached this. One being community conversations, in which our barbers led these conversations along with experts that we brought in to discuss and just invited in the barbershop, open conversations, anybody that wanted to come to talk about sex, to talk about sexual health, to really prime them for the actual intervention. Next slide. So the second part was a web-based application. So barbers in random conversations that would come up, they would recruit either parents and their child or parents alone. They could go home and talk to their children themselves. But the barbers recruited the people to participate in our project. We wanted to promote sexual health communication between them to have a good understanding of how they can broach the topic, what's a good age to broach the topic, and how they level the conversation depending on how old the adolescent was. And then we wanted to consider the community impact, like I said, of male social learning. Like, what do these role models of sexual health look like in the community? Again, what are the conversations being had about health centered around sexuality and sexual health? And then lastly, we wanted to consider race and racism's impact on identity and sexual behavior. So around this age, if you think back to the first time that you realized you were Black, not the first time you knew you were Black, you know, you're kind of born into it, but the first time you really realized you were Black, right? That happens around this formative years. And so we want to be able to let them understand how that shapes their health and particularly their sexual health. Next slide. So our results, the third part of it was conversation cards, but you'll see that on the next slide. So the results of that first kind of intervention, there were 6 modules that the participants received over the course of 6 weeks. There were 4 actual content modules because we wanted some of the content to kind of rest with them, right? So the first week they got just sexual health, sexual transmitted infections, and HIV. The second week they got these conversation cards, which we'll talk about in just a second, but we let that breathe for about 2 weeks because we wanted them to really engage with the conversation cards. And then the last 2 modules were around racial bias and identity. There were 52 parents. Inclusion criteria was just that they be a parent of a self-identified Black male adolescent. 71% of our parents were male fathers of teens. And so that was really exciting for us. And really what we wanted, it started off as a father-son initiative. But as we started to get into it, we had people coming and saying, hey, I'm a mom, single mom. I bring my child to the barbershop and I would really be interested in this program. Can I participate? We also noticed that we had folks that were in not non-racial concordant relationships also wanting to participate. And so we really had to rethink what the family unit looks like and how that could still be beneficial. So as long as the son was self-identified as a Black male, between the ages of 12 and 17, they were admitted into the study. And so we had 51 of those were Black male. What was interesting, we saw that almost 80% of our parent participants were either married or cohabitating and living in the home with and most were living in the home with a child. The scales we used was the parent-adolescent communication scale. And what we saw was a significant improvement in the quality, the length, and frequency of the communication. So we didn't just want to address whether or not they had a conversation, but we wanted them to self-assess whether or not they thought the conversation was worth it. How long was it? Did you really get into some deep conversations beyond just what was brought up, either with the module or with the conversation cards? We saw a significant decrease in folks having reservations about having these conversations, right? Like what prevents you from going to talk to your parent, or as a parent, what stops you from initiating conversations about sex with your child? And then what was really important to us, we saw a significant increase in the number of Black male adolescents tested after the event. So before 25 of our Black male adolescents had been tested, and after we had 33, which was really important to us. And we only had one that had a sexual debut during the 6 weeks. So of the people who had never had sex, only one had a sexual debut during that time. Next slide. These are examples of the conversation cards. So if you can imagine those little party cards that, y'all ask questions at parties and stimulate conversation, that's what's the basis for our cards. And so we wanted to ensure that we had cards that both the parents could ask of the adolescent, but also the adolescent could ask of the parent, right? So we wanted this two-way conversation and not just, again, this kind of top-down approach. But the cards were well received by both the parents and the teens. There were 31 total cards. Parents said the 21, that they used 21 of the 31. Teens said they used 25. So we don't know what happened there unless they asked some of their little friends about it. But on a scale of 5, it was 5 out of 5 had been shared with others, but with both parents and teens. On a scale of 20, their effectiveness score was 20 with both parents and teens. The engagement, connection, and communication all improved with this. And these are quotes from Work the Time was from a parent. Really interesting was from a kid. So we're really excited about these cards and what we can do with them. Next slide. So again, our lessons learned is, again, the diversity of families and really rethinking what we, our initial thought of doing father and son, which I think is still super important to have men and the male figure having discussions about sex with Black male adolescents. But we want to ensure that we have some communication spaces held open for all family types. And like the Dr. Ballard, and the men wanting healthcare, our kids want open communication with their parents and adults around them. They want to be able to have these conversations. They just don't necessarily know how, or don't know how it will be received when they do. And then finally, we learned that there's our barbers want and desire this level of inclusion in health access and healthcare community outreach with the community. So one of our barbers has continued the community conversation centered now around mental health. He's partnered with a therapist, and they do these barbershop talks monthly. The other barber has started a nonprofit, and he's doing a intervention around gun violence, and he led himself and has invited us to the table. So now as we're, as researchers, are supporting him versus, we coming into the barbershop asking for his support. So we've seen that these programs can be sustainable if done correctly and built with the right partners. Next slide. I think that's it. Thank you so much.
All right. Thank you so much. We're going to move on into our panel discussion. So I'm going to bring all of our panelists back to the stage. We do have some set questions that we're going to ask panelists. However, we are very welcoming and opening to questions from the audience. So please throw your questions in the chat and we will mix them in and get to them as we are asking our set question. Does that make sense, everybody? That works. Tough crowd tonight. It's okay. All right. Let's start off with, and any of our panelists can answer this. How do you see the role of barbershops evolving in the next 5 years in terms of promoting health and wellness within the Black community?
Could I jump in and answer?
Absolutely. Go ahead.
I'd say within the next 5 years, with our barbershops in our communities, with the cultural significance and trust and relationships that has already been established, and I'm talking barbershop to client relationship within the community. I think within the next 5 years, with it being such a hot topic or a hot environment now, social media wise, and it being having a lot of light shed on just the coolness that comes with being able to have those conversations, or to shed light on the conversations that have already been happening, utilizing that space and just seeing more and more barbers who are open and understand the importance of the platform and the area that they have to really get to the community and really serve the community in different ways. I think that with the collaborating that we've been doing, with the educating that we've been doing, and the resources that we have access to, building those relationships with the barbers, I see growing and increasing rapidly all throughout the nation, especially in underserved communities. And I think that with events like cut hypertension program that Dr. Thames has in California, just knowing that this individual is able to go into with a team and treat patients that may have hypertension and educate in the setting of a barbershop. So I think that with seeing these types of programs that are already starting to flourish and know that that it's very effective, that in the next few years, the barbershop will be that place where Black men come in and they know, yeah, I'm coming to get a haircut because I want to look good, but I also want to feel good as well. Not only aesthetic wise, but within. So being able to come in and know, well, I've been having issues with feeling lightheaded or feeling dizzy. I don't know what it is. And know that you have someone in a chair next to you or a professional in the setting that's able to educate you and provide you resources. Most importantly, just trusting. If we continue to offer these services and pour into not only our community and the members, but into the Black businesses, these barbershops, so that they can continue to do the work that means that much to them, and continue to have these spaces for us to go in and feel seen and heard, and know that, you know, as a Black man in America, if I want to take care of myself in any kind of way, I have access to, and I think that we'll see a continuous and increase in barbershops and the significance it really has in our communities.
Thank you for that, Josie. Thank you. Dr. Williams, I see you want to jump in real quick with a comment.
Yeah, absolutely. I think that as we're thinking about barbershops, I think it's also important for us to consider barriers that I've seen rise up within barbershops since in my lifetime, right? So since I've grown up, now I see, you know, you have to make an appointment to get a haircut, right? I went to the barbershop the other day, they told me $200 to get a haircut, right? Like, so there are these barriers that are coming up that's actually, I think, negatively impacting our abilities as healthcare practitioners to be able to do these things. So I think that it's important so in the next 5 years, I see individuals like, there's a gentleman by the name of Aaron Perry, who is in Madison, Wisconsin. That's where I got my PhD from, in Madison, Wisconsin, where he built the nation's first clinic inside of a barbershop, right? So I think that there are going to be more opportunities for us as practitioners to come in, build these spaces, and then put barbers on salaries to be able to to be able to make these types of interventions in our community, and hopefully make it more of the type of third space that we know it to be. But I think that the appointments, the high rates of entry, right? These LeBron James costs to get your haircuts, I think it creates even more barriers for the folks who we are trying to reach.
Excellent point. I'm going to tag in both Aaron King and Carter Todd real quick with this next question, just because of some of the work that y'all have done and which y'all have hit on during your presentations. Talk to me about what are some of the biggest challenges you've encountered in integrating health initiatives within barbershops, and how have you overcame them? Especially because I know there's people sitting there in the audience wanting to do some of these initiatives or have something in mind, and they're just hesitant on doing it.
Yeah, that's a good question, Dr. Johnson. I would say it would be availability and access, and not necessarily access for geographic, but just time, right? We know men, most of us are working, we're providing for the home. So having the availability to step away and get a haircut, right, is already an ask sometimes. I know for me, if I'm on child duty or my wife is working, sometimes I have to take my kids with me. So I know just from our last couple of years, making it to the barbershop and having to bring the kids can be a barrier. It already was talked about, the financial piece. And then also just the other obligations that we have. Not to say that our female counterparts don't also have obligations, but we know when it comes to ourselves and our mental health, sometimes we might have to triage things, and that might come towards the bottom.
Yeah, I think that so some of the challenges looking at, I think initially like what became our program, right? I think initially, you know, just like it was funny because I kind of laughed about this at a graduation, this being the last time someone mentions COVID in the graduation, but like we all had kind of been impacted by COVID. And I think that was initially our idea when Carter and I came together for our program, right? And what we really wanted to do is reimagine and become innovative with the outreach that we're doing, and not just to limit it within the walls of the barbershop. We wanted to have kind of like a bigger event, like a health fair, and we grew it out, and you know, boom, COVID happened. So we had to go to the drawing board and think about what can we do, right, that could still be innovative, right? We're supposed to be setting an example by not gathering and all this stuff, but how can we reach a larger audience? And I think that's where, you know, we birthed that idea for a virtual event and streaming it into the barbershops instead of us physically being there. Strangely enough, now we've had this second term, we're back in the barbershop, right? And thinking about a sensitive topic such as mental health and making sure that that is a closed space, right? And that is very private and not very public. So I think that it just kind of depends on what we're focusing on, what is the topic of the intervention, what is it that we're focused on, how big should it be, or, you know, how intimate, you know, should it be? I think it's kind of weighs on both sides.
And one more piece just to close that out, Dr. Johnson, I'd be remiss to not discuss funding, right? So we were fortunate to get grant funding, but that we know that comes in cycles. So if we're looking at these healthcare organizations to really be able to support the work in the barbershop, how do we quantify the work of preventative outreach in the Black male community, specifically these mental health spaces, and secure funding that doesn't come in cycles, but that we know is there every time the budget season comes around?
Absolutely. Thank you for that. I'm gonna bring my good cousin, Dr. Reagan Johnson, back to the platform to ask this question. Dr. Johnson, you've done a lot of work that you mentioned on, and even more that you haven't touched on. So I'm very interested in, are there any future initiatives or projects that you would be excited to see, or that you may have in a pipeline and are involved in, and now we get you to spill about it?
Yeah, we are still working with our conversation cards, got such great feedback that we're looking to expand that and go across the South doing that. Our next initiative, like I said, is working with the gun violence, and it is a really and so far it's been already impactful, and working with school systems. So the Barber has partnered with the local school system, the police department, and other community advocates to develop like wraparound services for after school programs to reduce alcohol violence, but gun violence as well.
Amazing, amazing. Thank you for that. Dr. Ballard, where are you at?
So as far as future research, so for my particular project, I focus on the urban dwelling African-American men. However, I mean, we're not a monolith, you know, as a group. So I would like to look at other groups such as people, I mean, men in rural communities, and also compare communities and looking at locations and how that differs as well, and bringing in socioeconomic status and things of that nature as well. And ultimately, all of this work, I mean, is in order to impact policy, because that's where you're really going to get change at, is looking at the national level of how these things can make changes.
Absolutely. Dr. Ballard has research pouring out of his pores. Y'all hear that? We are open to questions from the chat. Please, please, please throw them in. While people are throwing in questions, I'll also share some information and have everybody jump in on this take. So we talk a lot about what we do in the barbershop. Recently, I have seen some things where people have kind of like brought the barbershop into somewhere else, and as well as creating spaces with the barbershop included, meaning not in a physical barbershop. So what I tell you is that I have a friend, Sean Williams, who runs the Dad's Game. If anybody's ever seen him, he created this thing called the Dad Lounge for Father's Day, where he had a bunch of things for men talking about them, but then also he had a barbershop chair there, right? Because they just know the essence of men want to come in, they want to look clean, feel good, but also the barbershop chair just automatically starts conversation, right? So how do y'all feel about people repurposing spaces and bringing barbershop news in it? The other one was I'm in a process of creating, and I'm not supposed to be sharing this, but I am anyway, because we're family, creating a men's health luxury lounge where we come in to discuss men's health lounge. Like we repurpose the space to have these different things, barbershop chair, like pool table, we'll have facials for men to get, but all talking about different healthcare forms, right? We'll have panels, give out things. And then also we're going to run a therapy simulation live in front of everybody to kind of normalize it for Black men. So tell me how y'all feel about people utilizing that barbershop space to recreate spaces. Is it exploitive or is it needed?
Dr. Johnson, I think that as long as there's sensitivity around it, specifically that we're not encroaching on their business, right? This is where these barbers are making money. I know for Cut to the Chase, Dr. Williams was very deliberate in finding times outside of regular business hours, right? We're not going to be up on there on a busy Saturday morning, taking up all the space. So when hearing you talk about those other spaces, and it sounds like you're utilizing it in a different way, I think that that's actually the most beneficial. And you're, in essence, you're using the shell of the space and the sacredness of that room more so than the actual time that the barbers are utilizing it.
Amazing. I heard somebody else that wanted to jump in before.
Yeah,
Hand raised.
I agree with what Carter said. The sensitivity around the barbers, but I think also the sacredness of the space, because I feel like oftentimes, we see it all the time where trying to find good words. We see outsiders that come in and they want to take the fancy pictures and put it up in articles and kind of sell us out a little bit, right? And we have to understand that what we're doing in barbershops and the work that we're doing is and it was really highlighted throughout all these presentations. It's not that Black men or women, but Black men specifically are not interested in healthcare, right? We just don't receive healthcare in the way that's popular, right? We're not going to the clinics, we're not going to hospitals, and for many reasons, we don't feel welcome there, right? And we see it. If it wasn't for women having to deliver in hospitals, they're already looking out for other opportunities, right? And we see this already with the outcomes that we see in maternal health, like the statistics are there. And so what we need to do is make sure that we uphold that sacredness and that the trusted space as our priority, right? And not interrupt the businesses also of these barbers because they're more than willing to open up the doors for us, but we can't let it be exploited. I think in addition, we do have to start looking at, I think, some policy around how could we train our barbers, right? I think that looking at the individual work that we do, there's just not enough of us to go everywhere, right? There's places up in, where I lived in Redding, California, where it's like 0.8% Black, right? There's not enough people to do that kind of work. But if we make it part of the licensing, the requirements to look at, to do some education around mental health, maybe even first, basic, hypertension education, really basic information. We know that these barbers they're more than willing to reach out to their clients and connect to their clients on that level. But one thing that we can't expect them to do is do it for free. Like we can't just keep doing that for them. We need to really create, incentives, or we need to provide it as part of their education. They're already paying so much to go through school. So I see it on several levels. And so if for whatever reason we could get it as part of their training, I think that it would impact more people.
Yeah, I agree. And just to add on, I'd say like with these ideas and utilizing the idea and the significance of the barbershop in different spaces, I think as long as these barbers and these business owners are at the table when decisions are being made regarding utilizing the idea of what barbershops can do in different spaces. I think in that sense, having them be a part of or feeling a part of, you know, whatever it is that's going on, because at the end of the day, you know, it is what puts money in their pockets and pays their bills. So just including them, because including them is sort of like, now you're not only including them, they have the ties to the community. So you can try to replicate, you know, the idea of a barbershop or that type of scenery in a different setting. But, you know, as the new generation would say, it's not going to hit like it would if it's coming from the actual community member who's there building with these clients and community members on a daily basis. So they have to be at these tables with these ideas and being a part of any decisions being made, in my opinion.
Yeah, I would just want to piggyback off that, just to ensure, I would say the most important thing is just ensuring that the space feels authentic, right? So when we're having our group therapy sessions in the barbershops, there's some times where it's like, whoa, okay, like a person wouldn't say that in normal therapy, right? But it's because it's in the barbershop setting, it makes them feel more comfortable. There are a little bit more jokes cracked and folks feel a lot more comfortable. I think when you attempt to replicate or commodify that space and make it seem as if, okay, we're going to add these things here and add these things there so folks think that it is, the people who are present or people who are watching it you can feel it. Like whenever I'm watching The Shop by LeBron, that doesn't feel like a barbershop. It feels like, oh, we have chairs here. You're clearly in a studio. People aren't being, it's real. It feels scripted. So I think that as long as it feels like the authentic space, there's several books on barbershops. One is called Barbershops, BET, and Bibles by Melissa Harris Perry. And she talks about the reason why it's a sociological book, and it talks about why these spaces were created for African-American men specifically to be able to speak freely, and the sacredness behind it. So if that space is kind of being, replicated so, we can make more money or rise our star or for our ego and not for the benefit of the community, then folks will be able to tell.
Great points, everybody. There was a question/suggestion from Fallon Flowers. I just want to read it off. Are there any efforts for the barbers to be trained as community health workers for mental health? Could also be an additional source of income for them potentially.
So I would like to add something about the importance of that here, because I had a unique situation with the barbershop that I went to where the owner of the barbershop was actually a nurse practitioner. And so his clients actually really did come look to him for health advice, and just these were just general barbershop conversations. And you really got to feel them with the barbers of how they were Black men's health was important to them also. And so I think arming them with the tools, I mean, even just resources of being able to pass that to the clients, I mean, would be really, really helpful. And I even saw in the chat that I believe it was Miss Fuller said that she taught barbers CPR. Just kind of being able to pass those things along is super important, because again, you look at that trust factor, and that's how you can get the buy-in of the community and these African-American men.
Absolutely. Absolutely. Dr. Fallon Williams also added, and we may have to ask you about this because she threw out some funding. They can use WIOA for the education payment as a community healthcare worker. Please share what those initials stand for so that we can utilize them. All right. Any last questions before I turn it back over to our organizer and man of the hour? All right. Well, I want to say before I turn it over to Dr. Dwayne, everybody, thank you for allowing me to lead and moderate this great conversation. That was really good. It feels like 2 hours just flew past, which always happens when you're having a good time. So thank you. Dr. Dwayne, come up. Whoever's controlling the music, please cue Kendrick Lamar, They Not Like Us, for his introduction.
So next slide. So real quick to join us, note that those were the QR codes. So let's give everyone a round of applause. So if you can give the emoji or whatever you want to do, show me your hand claps. So wasn't this a astounding, great event, chock full of information, So as we bring this incredible day to a close, I just want to take a moment to reflect on all that we learned tonight and the powerful role that barbershops play in meeting the needs of the community, by the community, and for the community. So the innovations to pull us together demonstrates the power that we have as nurses to close these gaps in healthcare and to advance health equity. So as a heartfelt thank you goes out to all the distinguished panelists. I appreciate all the information you gave us. Your contributions were invaluable. You are truly changing the lives of a community that will have a tremendous ripple effect. So we as DMPs of color aim to change the game, forge new paths by elevating the expertise and the significant contributions that we make to nursing practice. So please be sure to join us if you have not done so already. So we are still open for membership, and we have levels and payment options to meet your needs. So join us. And we also have a host of events coming up. So please visit our website, go to the events tab so you can see what we have coming up. If you want CEs for tonight's event, you should see a QR code on your screen right now. So make sure you scan that QR code. We're offering 2 credits. So please scan the code and complete the evaluation form. And I appreciate Dr. McCamey for putting a link to the evaluation as well. If your phones have issues with scanning the QR code, go ahead and click that link. So thank you again for attending the DiMENsions in Nursing events, and there'll be future events in the near future, so stay tuned to announcements, emails, and social media posts. So at this time, we'll close out. I'll just ask the panelists and the board members to